So what is the difference between a pregnancy test that uses blood and a pregnancy test that uses urine? Maybe you've been getting inconsistent results at home with urine tests and you're ready to go to the doctor to get that blood test. Or maybe you haven't gotten your period, but you also haven't gotten a positive result at home, so you're considering going to the doctors for that blood test. In this video, I'm going to break down the different HCG thresholds that will give you a positive for each of these tests and also some other factors to consider. Stay till the very end and I'm going to tell you the 4 most sensitive at-home urine tests that you can get that detect at levels of 25 or lower. So first, let's define HCG, which is the hormone that each of the tests is looking for. If you have a level of HCG that is high enough, both the blood and the urine test will tell you that you're positive and you are in fact pregnant. So HCG is a hormone produced by the placenta during pregnancy. It is used as a marker to confirm pregnancy in both urine and blood tests. However, the threshold levels for a positive result can differ from the two tests. If a urine test is positive, it's typically detected when HCG levels reach 25 milli-international units per milliliter. This threshold can vary slightly depending on the brand of test, but generally a level of 25 or higher is considered to be a positive result. And that's why I want to share those extra sensitive tests that identify pregnancy at a level of 25 and below. In contrast, blood tests are much more sensitive and can detect a lot lower level of HCG. You can get a positive result with a level of 5 HCG or more with a blood test. This makes blood tests much more reliable for detecting pregnancy earlier than urine tests. Typically, you can do urine tests at home, while blood tests are going to be available at the doctor's. So if you aren't sure if you're pregnant and you haven't gotten your period or you've been getting inconsistent results, blood tests may be a go-to because it does detect pregnancy at such a low level. Now, technically, if you have a level of HCG that is 6 to 24, it's really a gray area and your doctor is most likely going to want to test you, which is why the threshold for urine tests is typically 25, because once you're past that 25 level, it's pretty certain that you are in fact pregnant. It's also important to note that HCG levels vary so vastly from woman to woman. In addition, the timing of the test can also affect the results. For example, HCG levels typically double every 48 to 72 hours in early pregnancy. So if the test is taken too early, a negative result may be obtained even if the woman is actually pregnant. Other factors to consider include the type of test being used and the quality of the sample. Some tests are more sensitive than others, and using a high-quality sample such as first morning urine can improve the accuracy of a urine test. In summary, your blood test is going to be the most sensitive, but can also give you gray area results because the threshold is so low. So if you do get a blood test and it is positive, but you're not past that 25 threshold, your doctor will most likely want to see you in a couple days because that HCG level will be doubling rapidly if you are in fact pregnant. If you've been getting inconsistent samples at home, a blood test and going to your doctor may also be a great option for you, just to verify results and put your mind at ease. Now let's jump into the 4 most sensitive at-home urine tests that you can get that detect at a level of 25 HCG units or lower. So that is going to be the Clear Blue Digital Pregnancy Test. This test can detect pregnancy as early as 5 days before a missed period and has a sensitivity of 25 mLu over ml. First Response Early Result Pregnancy Test. This test can detect pregnancy as early as 6 days before a missed period and has a sensitivity level of just 6.3 mLu over ml. The EPT Early Pregnancy Test. This test can detect pregnancy as early as 6 days before a missed period and has a sensitivity of 22 mLu over ml. Number 4, AccuClear Early Pregnancy Test. This test can detect pregnancy as early as 5 days before a missed period and has a sensitivity of 25 mLu over ml. And again, if you are doing an at-home pregnancy test, be sure to use your first urine in the morning for the most accurate result. If you like this video, give it a thumbs up, and we'll look forward to seeing you on the next one.